An electrocardiogram, or EKG, records electrical impulses that occur in the heart. This video will review placement of the EKG leads and recording of the impulses for a lead 2 evaluation. This is the most commonly monitored EKG lead. We will also briefly discuss the characteristics of a normal EKG, so that you may recognize abnormalities that can be brought to a veterinarian's attention. Performing electrocardiograms on animals is an excellent tool for diagnosing cardiac abnormalities. The heart muscle contracts in response to an electrical impulse generated from the sinus node of the atrium. This impulse is passed into the ventricles and initiates a coordinated muscle contraction that pushes blood out of the ventricles in the most efficient manner. Many injured or ill animals will have abnormal heart electrical impulses called arrhythmias that affect their perfusion or increase the risk for anesthesia or other procedures. The following materials will need to be prepared prior to beginning an EKG. An EKG machine, 3 or more wire leads, a set of clean alligator clips or electrode pads, conduction gel or alcohol, clean hair clippers, 1-inch medical tape. To begin, connect the leads to the EKG machine. The patient should then be placed in right lateral recumbency and gently restrained to avoid sudden movements that can disrupt electrical recording. If the patient is reluctant to lie down or is in respiratory distress, obtain the reading in the least stressful position and label the strip with the patient's position. When using alligator clips, clip a small amount of hair below both elbows and below the right knee and moisten these areas with alcohol or conduction paste to enhance conductivity between the patient and the clips. You can now connect the leads with alligator clips to the prepared skin. The leads are usually already marked and color-coded to indicate which leg they will go on. When using electrode pads and snaps, clip the dorsal area of the metacarpal and metatarsal area of the limbs as exhibited here. Clean the area with alcohol to remove any oil and debris and allow these areas to dry. Place the electrode pads over the prepared skin. Most electrode pads already contain conduction gel. However, you can add an additional small amount if desired. Apply 1-inch medical tape with enough pressure so that the pads remain in place, but do not constrict the blood flow. Connect the wire leads with snaps to the pads, as shown here. You can now turn on the EKG machine. Observe the lead 2 electrical activity for 1 to 2 minutes for abnormal waveforms. Record a strip of the current activity and place all of the recorded strips in the patient's chart for the attending veterinarian to evaluate. A rapidly oscillating waveform may indicate 60 cycling interference, as illustrated here. This is normally caused by outside electrical interference, such as other equipment being used in the nearby vicinity of the animal. If this is occurring, recheck each lead connection and make sure they are attached correctly to the animal. Be sure to secure any loose connections. If a clear EKG wave is still not showing, evaluate the following. Repair or clean any loose or dirty clips. Apply additional conduction gel or alcohol if necessary. Turn off nearby electrical instruments that may be creating interference. If the animal is panting excessively, trembling, or moving around excessively, it may need to be sedated. There may be the occasional need to monitor a patient's EKG for an extended period of time. One example of this might be during a prolonged anesthetic procedure. Electrode pads are most useful for continuous monitoring of EKG since the patient's comfort is improved and the connection is more easily maintained. Continuous EKG monitoring is difficult in animals that are anxious or moving around a lot. In these cases, sedation may be necessary. Whenever continuous EKG is used as a monitoring tool, the tone should be audible so that caretakers can hear changes in the impulses that may signal an arrhythmia. To discontinue EKG monitoring, begin by turning off the EKG machine. Remove all of the clips or electrode pads from the patient and clean them before storing. Check the patient for any irritation caused by clipping and the placement of leads. If skin irritation has occurred, alert the veterinarian.